to OncoTrial Insights with Dr. Pidugu, the podcast where we delve into the latest breakthroughs shaping the future of healthcare. I'm your host, Christina, and I'm thrilled to have Dr. Pidugu joining me today. Dr. Pidugu, welcome to the show.
Thank you, Christina. It's great to be here and chatting with our listeners. Just a quick heads up before we get started. The views expressed on this channel are solely my own and do not represent those of any institution, organization, or employer. This content is for educational and informational purposes only. Please consult your healthcare provider before making any healthcare decision. The information I will discuss is not meant to endorse or criticize any specific products or brands. My goal is to provide you with the educational content, shedding light on various topics.
Absolutely crucial disclaimer, Dr. Pidugu. Now, let's jump into the exciting new developments in the treatment of advanced urothelial carcinoma. A recent study published in the New England Journal of Medicine, titled Enfortumab Vedotin Pembrolizumab in Untreated Advanced Urothelial Cancer. For our listeners who may not be familiar, could you briefly explain what this condition is and what the standard treatment has been?
Certainly, urothelial carcinoma is the type of cancer that develops in the urothelial cells, which line the inside of the bladder. Bladder cancer incidence increases with age and is more prevalent in men than women. In 2025, projections indicate approximately 84,870 new cases and 17,420 deaths. Unfortunately, only 34% of bladder cancers are detected at the localized stage, which has a 5-year relative survival rate of 72.6%. Survival rates are significantly higher for in situ tumors, 97.9%, but decrease considerably for a regional, 40.5%, and distant, 9.1% spread. Locally advanced or metastatic urothelial carcinoma refers to bladder cancer that has spread beyond the bladder, either to nearby tissues or to distant organs. For many years, the primary treatment for these patients has been platinum-based chemotherapy. This typically involves a combination of gemcitabine with either cisplatin or carboplatin. While initially effective, long-term outcomes have historically been poor, with a relatively low 5-year survival rate. Therefore, the need for more effective first-line therapies has been a significant area of research.
Absolutely. And that leads us to the important EV-302 trial, which looked at a new treatment combination. Can you tell us about the treatments involved?
Yes, the EV-302 trial explored the combination of Enfortumab Vedotin and Pembrolizumab. Enfortumab Vedotin is an antibody-drug conjugate. It is designed to specifically target Nectin-4, a protein frequently found on the surface of urothelial cancer cells. The antibody component of the drug binds to this protein, delivering a potent chemotherapy drug directly into the cancer cell.
That sounds like a very targeted approach. And what about pembrolizumab?
Pembrolizumab is a type of immunotherapy known as a PD-1 inhibitor. PD-1, or programmed death 1, is a protein on immune cells that can act as an off switch, preventing the immune system from attacking cancer cells. Pembrolizumab functions by blocking this PD-1 protein, enabling the body's immune system to recognize and fight the cancer.
So, this combination therapy integrates a targeted drug delivery system with immunotherapy to enhance the body's natural defenses. That's a fascinating approach. How is the EV-302 trial conducted to assess the effectiveness of this combination?
The EV-302 trial was a phase 3 global open-label randomized study. This means it included patients from various locations worldwide who were randomly assigned in a 1-to-1 ratio to receive either the Enfortumab Vedotin and Pembrolizumab combination or standard platinum-based chemotherapy. 886 patients were assigned to receive 3-week cycles of either Enfortumab Vedotin, 1.25 milligrams per kilogram of body weight intravenously on days 1 and 8, and Pembrolizumab, 200 milligrams intravenously on day 1, or gemcitabine plus cisplatin or carboplatin. The open label design indicates that both patients and researchers were aware of the treatment being administered. The primary objectives of the trial were to directly compare the treatments in terms of progression-free survival, which is preventing cancer progression, and overall survival.
And what were the key findings of this important trial? What did the data reveal about the effectiveness of this new combination?
The results were quite significant and very encouraging. The trial demonstrated a statistically significant and clinically meaningful improvement in both progression-free survival and overall survival for patients receiving the Enfortumab Vedotin and Pembrolizumab combination compared to those receiving standard chemotherapy. To provide specific data, the Enfortumab Pembrolizumab combination showed a median progression-free survival of 12.5 months compared to 6.3 months in the chemotherapy group. This represents a 55% lower risk of disease progression or death. The median overall survival was 31.5 months in the combination group versus 16.1 months with chemotherapy. This translates to a 53% lower risk of death, with the median overall survival in the combination group nearly double that of the chemotherapy group. These benefits were observed across various patient subgroups, including those eligible or ineligible for cisplatin and regardless of PD-L1 expression levels. In terms of response rates, 67.7% of patients responded to the combination therapy, compared to 44.4% in the chemotherapy group. Furthermore, the complete response rate was over 29% in the Enfortumab Vedotin Pembrolizumab group and 12.5% in the chemotherapy group. The median duration of response was not reached in the Enfortumab Vedotin Pembrolizumab group and was 7.0 months in the chemotherapy group, indicating more durable responses with the combination therapy.
That's great news. It sounds like this combination could be a big improvement for many patients with this aggressive cancer. What about safety? Were there significant side effects?
As with any cancer treatment, adverse events did occur in both groups, which was expected. However, serious, grade 3 or higher, treatment-related side effects were lower in the combination group, 55.9% compared to 69.5% in the chemotherapy group. And when you factor in those patients on the combination, therapy typically stayed on treatment longer. The safety profile looks even more favorable. Most side effects, such as peripheral neuropathy, rash, and itching, were manageable. We didn't see any new safety concerns. The known side effects of Enfortumab, like skin reactions and high blood sugar, and Pembrolizumab, such as pneumonitis and hepatitis, were present but controllable with early intervention. So, while side effects were common in both groups, the rate of serious treatment-related events was lower with the combination, especially impressive given the longer treatment duration. This suggests the combo is not only effective but also manageable for many patients.
That's such an important point. A treatment might work well, but if the side effects are too severe, it can really affect a patient's quality of life. It's good to hear the combination group had fewer serious side effects. The study did mention some limitations. Can you briefly go over those?
Absolutely. Like any study, this one had its limitations. First, it was an open-label trial, which can introduce some bias. Another factor is that the use of maintenance therapy after chemotherapy, common in real-world settings, wasn't fully accounted for when the trial began. This makes direct comparisons with subgroups who did receive maintenance therapy a bit more complicated. Lastly, it's important to acknowledge that Black patients were underrepresented in the study. So, more data is needed to ensure these findings apply broadly across all racial and ethnic groups.
Those are all critical points for future research and clinical application. Given the overall results, how would you sum up the importance of the EV-302 trial?
I believe the EV-302 trial marks a major advancement in the treatment of locally advanced or metastatic urothelial carcinoma. The strong evidence of improved progression-free and overall survival, alongside a manageable safety profile and consistent benefit across diverse patient groups, makes a strong case for using Enfortumab Vedotin plus Pembrolizumab as the new first-line standard of care. This trial could truly represent a paradigm shift in how we treat this aggressive disease, offering real hope for better outcomes.
Thank you, Dr. Pidugu. That was incredibly informative. We appreciate you breaking down the EV-302 trial and highlighting its potential to transform care for patients with advanced urothelial cancer. It's inspiring to see such progress in cancer treatment.
Thank you, Christina. It's vital for patients and their families to stay informed about these kinds of advancements.
That wraps up our conversation with Dr. Pidugu on the groundbreaking EV-302 trial and what they mean for patients with advanced urothelial carcinoma. Thanks for joining us on OncoTrial Insights with Dr. Pidugu. If you enjoyed this episode, don't forget to subscribe, leave a review, and share it with your colleagues or anyone who might find it helpful. We'll be back soon with more updates on the latest clinical trials and advances in cancer care. Until then, stay curious, stay informed, and keep pushing for better outcomes.